Hey guys, welcome back to the channel. Today we are talking about a really common elbow injury called lateral epicondylitis or tennis elbow. Probably the biggest misconception about lateral epicondylitis is that people think that you can only get it if you are a tennis player, which is just not true. It actually is a really common repetitive strain injury, and you can get it from all sorts of activities, so not even just sports. Today you're going to learn two things in the video. Number one, what is lateral epicondylitis? And number two, what movements or activities or postures are going to cause lateral epicondylitis or make it worse. So let's dig in. First things first, what is lateral epicondylitis? It's actually a tendinopathy. Tendinopathy is just a really fancy word that means damage to a tendon. And so our tendons are the bridge between our muscles and our bones that attach the muscle to the bone to allow for movement of our joints, movement of our body. Over time, with repetitive movements or awkward postures, or sometimes improper lifting mechanics, or kind of being in certain positions that cause a little bit of strain, the tendon is getting micro tears or micro traumas that is normal for a tendon, but in the case of tendinopathy, the tendon doesn't actually heal or repair itself in between. So we get into this chronic cycle, essentially, of the tendon tearing or traumatically being, torn over time with certain movements. It doesn't heal itself, and then we do the activity again, it tears more, it doesn't heal itself. So it's really a cycle that develops into a tendinopathy or even a tendinosis. And so that's kind of the basis of where we're starting to develop this damage to the tendon attachment. Most often, lateral epicondylitis is a repetitive or overuse injury rather than a traumatic injury. Occasionally we see it as an acute or a traumatic type of injury, so somebody will fall wrong and that will cause damage to the elbow, or like a piece of equipment will hit them or something like that right in that area where the tendon attaches and causes damage to the tendon that way. But most typically it's repetitive use of the arm, the wrist, improper lifting techniques, and it gradually happens over time. The tendon that's damaged in lateral epicondylitis is called the common extensor tendon. It actually is a combination of 4 muscles that join together into one tendon attachment that attaches on the lateral epicondyle on the outside of the elbow. And so when we're looking at the arm, right, so right here we've got our elbow. That pointy bone at the back is the olecranon, of course. The lateral epicondyle is actually right on the outside of that. It feels almost like a golf ball, right? So it's a very round, bony prominence. That is where the tendon attaches, and an easy way to find the actual tendon is to kind of palpate or push over that area just below the lateral epicondyle and do wrist extension, finger extension. You'll be able to find that spot because you'll feel the tendon engaging and stretching. So that is the area that we are talking about, and that is the tendon that's damaged in tennis elbow. For tennis elbow to start and develop, we have overload, extreme stress at the common extensor tendon. That leads to inflammation and damage, tendinosis essentially, of the extensor carpi radialis brevis tendon, which is going to develop into the syndrome called tennis elbow or lateral epicondylitis. Now that we have a basic definition of what tennis elbow is, let's talk about the movements that are going to cause it to occur or to get worse. So any type of repetitive wrist extension is going to absolutely put strain at the lateral epicondyle and that tendon attachment. But people also oftentimes develop it from having to lift things, especially with the palm facing down and especially with their arm out far away from them. So it's always better to lift close to you, but sometimes with work tasks or certain activities, we have to have our elbow extended to be able to actually reach and lift the object. The other thing that oftentimes we do, especially when lifting something heavy, is when we're gripping, we will naturally reflexively put our wrist into an extended position to be able to be stronger with our grip. And that's actually called tenodesis. So let's demonstrate it together so you understand what tenodesis is. So for a moment, just let your fingers completely relax and only move the wrist. When we flex the wrist forwards, you'll notice that the fingers naturally extend. When we go to bring the wrist back, take a notice how your fingers curl naturally. Do that a few times. So that's called tenodesis. It actually strengthens our grip when we're in an extended position, but that puts a lot of force and a lot of overload tension at the lateral epicondyle. Over time, these repetitive movements and awkward postures are going to cause chronic microtraumas and tearing at the tendon attachment, which can lead to tendinopathy, including lateral epicondylitis or tennis elbow. I hope that this video was helpful in giving you a basic definition of what the heck tennis elbow is, and some ways that people get it, or kind of movements that cause it to get worse. If you like this video, please subscribe for more hand therapy content so that you never miss out. As always, thank you for watching, and I'll see you next time.